Welcome back to the Game-Changing Women of Healthcare. I'm your host, Meg Escobosa. A quick note before we get into today's episode. We are currently looking for sponsors for the podcast. If supporting and encouraging female leadership in healthcare is important to you or your organization, help us do that by becoming a sponsor of the Game-Changing Women of Healthcare. Reach our engaged audience with a mention by me in future episodes, or we'll produce a short audio spot for your organization. At the Krinsky Company, we believe in female and diverse leadership in healthcare. If that's important to you too, become a sponsor of the podcast and proudly share your values with the world. Reach out to us at podcast@thekrinskyco.com. And thank you. Welcome to the Game-Changing Women of Healthcare, featuring exceptional women making an impact in healthcare today. Together, we dig into the many healthcare issues we face today and how these innovative leaders are working to solve them. And we celebrate our guests' accomplishments, setbacks, and the lessons they've learned throughout their careers. I'm Meg Escobosa. Join me in conversation with some of the many brilliant and courageous women on the front lines of the future of health. Welcome back to the Game-Changing Women of Healthcare. I'm your host, Meg Escobosa. Today on the show, we have Caitlin Donovan, the global head of Uber Health. Early in her career, she worked in finance as an investor at Bain Capital and as a member of the internal consulting group Summit Partners. Just before joining Uber Health, she was the chief operating officer for MyOrthos, an orthodontic services organization. And prior to that, Caitlin developed an interest in tackling obstacles to patient care in senior roles at specialty benefit managers in the non-emergency medical transportation space, circulation and logistic care, now known as Motive Care. She has also served as vice president of operations at CareCentrix with a focus on home health and post-acute care. Welcome to the show, Caitlin.
Thank you so much for having me, Meg.
We are very fortunate to get to talk to you. You guys are really doing some interesting work and trying to solve some important gaps in care and access issues. You guys launched in 2020, is that right?
So actually, Uber Health has been around since 2018, but I joined the company in 2021, and I'd say was able to build on some of the foundations that the team had developed to really fully integrate us more deeply into the healthcare ecosystem. In a way, to your point, that we're really trying to focus on optimizing those existing funding sources, those existing benefits, and closing gaps in care.
Okay, awesome. Because you guys have seriously made some growth gains in the last few years. Can you, I saw there was an article in Forbes talking about 300% growth from 2020 to 2022. Maybe that's the Caitlin effect. And you have, I think, a 75% increase in gross bookings from 2022 to 2023. And you guys are working with over 3,000 healthcare organizations?
Yep, that's exactly right. We've been really lucky over the past 3 years to identify a need in the market. Just to back up a bit, it might be helpful to explain what Uber Health is and how we achieved that growth. A lot of folks think of Uber Health as you pull out your phone, you open the Uber app, and then you use it for healthcare. But it's actually so much more than that and in a completely separate tech stack. The way that we're built is we're a full platform that allows for supplemental benefit access for transportation, prescription delivery, grocery, and over-the-counter benefits, where we have a web-based, what we call the dashboard, that call centers can access, provider groups can access, care coordinators can access, social workers can access, and tap into those benefits that very often exist, but are sub-optimized and underutilized. And then recently, we just announced our partnership with Optum Financial Services so that with their flexible spending cards, members that have one can actually use the Uber app, whether Uber or Uber Eats, to request rides, grocery, and over-the-counter items in a way that's fully compliant with the benefits their health plan offers. So real value is taking these benefits and making them available in an omni-channel way.
Very nice. What is your awareness campaign? Is your channel essentially providers helping their patients find out, or is it the health plan? Can you just describe that whole
That's a really good question, and I think a particularly tough one to answer for the healthcare environment. What we've realized is healthcare is an ecosystem, and so often what breaks is when the ecosystem isn't connected. And we've been really conscious of that. And just to give a couple of examples there, often health plans offer benefits like transportation or like grocery and over-the-counter goods, but it's a complete black box. The patient doesn't know that they exist. Providers that are taking risk and trying to keep patients healthier may want to use them and not know they exist. And so one of the things that we've been doing is optimizing those existing benefits by making them more available and making more transparent what you can do while reducing that homework both for the provider and the patient. Practically, what that means is we need to talk to health plans because we need to be a part of their network. We need to be able to tap into their benefit designs and help optimize those benefit designs. But our users are not the health plans because that's the crux of the issue
Yeah.
is that the way they're administered prior to Uber Health was very siloed. I have one number to call for transportation, a different one to use for grocery and OTC. And so making an awareness campaign across those 3,000 providers that were embedded in directly to members and everywhere in between, we have found has not only been really good for Uber Health's growth, but really good for the clinical outcomes that are tied to utilizing these supplemental benefits.
And of the health plan market, are you focused on the MA plans or a certain sector, or is it broad swath, the whole market?
It's quite broad swath. We tend to focus where benefits exist but are not optimized. So, for example, Medicaid has had a mandated transportation benefit since 1966. I think hopefully most folks saw that the Biden administration has encouraged state Medicaid plans to apply for 1115 waivers to offer food. For Medicare Advantage, transportation, grocery, over the counter items are really regular benefits. And so we tend to find a lot of focus there. But increasingly, even on the commercial and ASO side, employers are really interested in thinking about how to serve their employees and membership that, yes, may be employed, but may act a little bit more like a Medicaid population where these benefits make a lot of sense.
Mm-hmm. They make a difference. It's a savings, frankly, too, for the member.
That's exactly right. Where what's really interesting is by changing the way these benefits are administered without changing, the underlying actuarial model, you can drive some really interesting results. We've started running some studies that demonstrate the impact of where you put the benefit offering in a patient flow, and the results are candidly unbelievable. So we published a white paper called Rides for Moms, where we took a Medicaid population, by definition, had access to a transportation benefit. Prior to Uber Health, the utilization was less than 10%. And when you embedded Uber Health at two federally qualified health centers that already are seeing the patients, have the patients in front of them, are doing a social risk screening, and offering that transportation, to your point earlier, to close that gap in care on the spot, utilization went from less than 10% needing a ride to 44% needed a ride at least one time. And 3/4 of that population needed it for every single appointment.
Wow.
And then the clinical results followed through, which I think is the most important part there.
Mm-hmm. Yeah.
And similarly on the food side, we've been running a program in Georgia with a Medicaid health plan in Georgia. $150 per patient per month for grocery and over-the-counter goods. Just the existence of that reward, coupled with a nutritionist as a wraparound service, means that patients have been calling us to say, how do I use this benefit? And getting screened for things that they otherwise wouldn't have been. And 70% of the patients, we found an additional intervention, whether clinical or social, that needed to happen. And with that offering of food, 90% have adhered, which again just
That's
speaks
huge.
to how these benefits, if you don't forget about them and incorporate them into a program, can really drive results beyond just the offering of the service alone.
It's, to me, when I learned about Uber Health, it's wow, talk about core capabilities meeting a clear need and the great merge of the two. The devil's in the details. What have been some of those big challenges in executing? Because I think just getting through to your audience, the health plan audience, getting through to who in the provider organizations are the right people to connect with and make this happen. Tell us some of those stories about what is a big challenge that you have encountered in executing this vision.
Oh, that's such a good question. I think something you said, I think is key to how we operate, which is know your core capabilities, right? And we view that as take Uber's core capabilities and put that health plan, that healthcare wrapper on it so that you can be very specific to the ecosystem and industry you're serving. I view Uber's core capabilities, network of drivers, network of independent couriers, and candidly, our consumer brand and engagement with our customers that is so often missing from the healthcare space. And then what we've done on the Uber Health side is this is going to sound so boring, but we've really focused on data flows because that's what's been missing for supplemental benefits. It's a black box. And so thinking about how is something available? How do you request it? How do you pay for it in a really seamless way is how we've approached that tactically. To your point, what are the challenges of how you execute that? I think it comes back to pointing out where things don't make sense and then agreeing on how to make them make sense. So just to give a couple of examples, we were working with health plan, at-risk provider together, and you'd think that incentives would be aligned. The health plan has a benefit, the at-risk provider is taking risk on this patient, they're financially incentivized to do the right thing. Never mind, hopefully we're all in healthcare because we want to do the right thing. And they have a contract with Uber Health. What happened in practice is that there was a patient that was served by this provider that needed a ride. It was a preventative visit. This was for a chronic kidney disease patient, and it was urgent enough that it needed to happen right away. This patient lived in Kentucky, needed to cross the border into Cincinnati for service, and the patient had both Medicaid and Medicare coverage. Because the patient had to cross state lines, Medicaid wouldn't cover the ride. Because this had happened so frequently, they'd exhausted their benefit on the Medicare side. And we said to the provider, this still doesn't make sense. You're financially responsible for this patient. It's doing the right thing. You're saying the patient needs it. If it's going to keep the patient healthier, it matches what you need to do. And they said, I'm worried that the health plan's going to get mad because I've spent $1 outside of the benefit. What happened was the patient did need a ride. They had to call an ambulance, though. And so what would have been an $80 ride now went to $1,000. They crashed into dialysis. So not only do they have more dollars from a transportation standpoint, they're now in the hospital spending thousands and thousands of dollars for an inpatient stay. All of that was avoidable by changing some simple administrative rules. And so we've really taken that lesson learned on presenting those worst case scenario stories, pulling all parties in the room together to talk about what do you do for these corner cases that candidly happen way too frequently to make sure that not only does the technology and benefit exist, but that incentives are aligned and there's a common understanding of what doing the right thing means. And that's been really helpful for us, both for our growth, the membership that we serve, and hopefully the industry as a whole.
We really believe in bringing all the parties together to get aligned. Where are the gaps? What can we do to solve those gaps? Where are we not aligned? I'm curious how it's going. So you're dealing with state legislators, or how are you accomplishing the policy shift that needs to happen? Are you also engaged with the policymakers?
We really do engage across the board. I'd say the vast majority of our work is with MCOs and provider groups. But on the state legislature side, I think there's two ways to think about that. One is from a transportation benefit standpoint, every state offers a transportation benefit. And I'd say 2/3 have a way to use Uber and 1/3 do not. And what we're finding is those that do not allow utilization of Uber in Medicaid have extra benefit rides happening that are just more expensive for the system, candidly. And so we've been working on how do we bring down that cost of care by borrowing lessons from other states on the transportation side. And similarly, on the grocery access and food access for Medicaid, I think the concept of this is relatively new, and we're so excited on some of the programs that are being filed and requested right now. And so trying to work hand in hand to make sure that not only Are we solving a near-term and acute issue? But how do you scale that so that it's sustainable?
Yeah. So describe, you've got the grocery, you've got the rides, you've got over the counter, and I also saw prescriptions.
Yes, that's right. That's
That must be
absolutely
the
right.
latest and greatest new.
So we actually released it in spring of last year, and we find it is quite exciting. Again, coming back to why these benefits, it's because they're the core competencies of Uber. You're either moving people or moving things. And there's a really interesting funding source where our particular technology we think is good for the industry. On the prescription delivery side, it's really interesting seeing where there's interest, right? So, one, for 2025, adherence is triple weighted for STARS measures. So,
Okay, yeah.
obviously, there's an interest in making sure you can fully close the loop in how you think about driving patient adherence using those existing benefit dollars. And second, we're finding that a lot of transportation benefits approve rides to pharmacies and grocery stores.
Uh-huh.
And it is about 60% cheaper to deliver that prescription
Yeah. Get the person
versus pay
there.
for a two-way ride. And so we're actually seeing it utilized as a piece of other benefits, which is a very interesting construct and a really thoughtful way to take cost out of the system while over-serving patients.
Awesome. What do you think is next? Do you have other ideas for how to evolve the service?
I think we've been spending the past 3 years making sure that we have the pipes laid to have that data sharing to allow for optimization of benefits. These have existed for a long time and really were sub-optimized. And I think some of our results have proven that out. What I think is next is how do you then use these tools to more structurally engage patients in a way that it is easy versus local provider by local provider. And
Mhm.
just to give a couple examples, calling back to that study that I mentioned around food access and how engaged members were just knowing that they had food.
Oh,
And then thinking about, I know what I do when I'm in the back of an Uber. I have my phone out and I'm scrolling through it because I'm very bored. How do you use that captive time or attention from patients in a way that scales really well using technology? I think you'll see a lot of that coming from us over the next several years.
wow, that is very exciting. I can see a lot of uses of that access to their attention and time, and whether it be behavior change or insights or feedback or all kinds of potential there.
Exactly. Still figuring out the exact how, but I think there's a there with that theme.
Yeah, I
Yeah.
agree. Good luck with that. That's exciting. We'll be looking for that information when it comes out. What the purpose of our show is really to highlight innovation and, of course, great women leading innovation. I'm curious what your observations and takeaways are about how to successfully bring new solutions into the healthcare ecosystem. And I know you're saying you joined Uber Health, it was launched. You're bringing a certain skill set to the table. You've got a different perspective, a different experience level. I'm curious what you've observed. What does it take to bring a new idea into the market,
Yeah.
especially in healthcare?
I think that's the key phrase, especially in healthcare, where I think healthcare innovation happens from the inside out, not the outside in. And
Mhm.
being fully aware of that can lead to much clearer step function and lasting change. What I mean by that is before I joined Uber Health, I observed a lot of technology companies that had an asset, had an idea, and approach the healthcare ecosystem like they would the consumer world. A blank sheet of paper, this makes sense, here's how we drive adoption, not realizing that there's a well-established, highly regulated ecosystem that can't come join you on your blank sheet of paper very easily. So what we've tried to do is still use those ideas and core competencies, but really understand that entry point from within to then inch ourselves along more slowly. And I think that's worked really well, both for our company and then from how much progression we've seen around some of the standards of the way these benefits are designed, the way they're administered, and the impact on patients.
I think it's really interesting what you just shared about the idea of matching the healthcare ecosystem pace, if you will. Like
Mhm.
you said, go at their pace. Has that been at cross purposes at all with the Uber kind of startup or tech consumer tech company?
We are very lucky to have a lot of support here,
Mm.
but I do think recognizing recognizing the environment you're in, whether it's the healthcare ecosystem and how they're going to change or how to operate within a tech company is really interesting. I think it's well published how many millions of rides Uber does an hour a day, et cetera. And that means if you release a new product that's a consumer-facing product within a day if it worked.
Oh.
If you think about the healthcare innovation, I think what's the average time that's well quoted? It takes 7 years to scale. In our case, we've done a really nice job of cutting that in half, but that still means it's 900 times longer than the average Uber product. And so that means
Uber is unique.
but recognizing how you lean into your core competencies, lean into that pace candidly, but also match it with the realities of the industry that you're selling to, I think is quite important to be able to blend those two very necessary competencies.
How do you understand the sort of market need and evolve it how do you stay in tune with the market need?
Is a great question. I think it is really, really important to very much understand the industry, to understand exactly what your customers are literally saying and what you think they should be saying as well. When you're thinking about innovation, you don't want to be an order taker. You want to guide folks with you. And the way that worked for us and at past companies so that it's practical and you're not wasting precious resources building to a pipe dream instead of something that'll work is making sure that you're continuing having conversations, not just about what's now, but what's next with clear hypotheses of here's what we think you'll need. And then when you're getting a lot of bright eyes and yeses, having those follow-up conversations to say, of the 3 ideas we thought were next, let's focus on this one. That's how we do it. And I think it's worked well for us to date and looking forward to continuing to do it, to do that. Plus, it's really fun having conversations with folks in the industry who are much smarter than we are and seeing how we can contribute.
It's a great point. And I think just also, I know that in technology, you can get down a path, developing a solution very custom to a particular client's needs and their unique setup, but you have to keep making sure that you are reflecting a broader customer base so that you're not just designing a one-off solution that you're really thinking. That's a technology.
I think that's spot on. And I think the further out you can think so that you're part of the creation, not just the delivery, the more likely you are to build a scalable versus customized product.
Yeah, scalable is key. I've read about your experience and your insights about leading and designing well-balanced teams. It was really great to see that. What have you learned about yourself? And as your responsibilities have grown and your role has shifted?
I think it is really important to know what you're bad at, to be honest, because that has to be the first person you hire to round yourself out. And I think too often people make the mistake of hiring a clone of themselves, and then you just create an echo chamber versus an environment where you're making a team and ideas better. What I know I'm bad at is I'm really bad at writing things down. I have an idea in my head. I can keep the list in my head, but that does not work for a scaled team. And so someone who's more structured in the way that they organize themselves is a very nice compliment to me.
That's so true. I agree with you. Balance yourself out.
Exactly. Exactly.
Shore up the downside.
Yeah, you have to be thoughtful about what perspectives you want and make sure to fill them so that you don't have blind spots.
Yeah. Very nice. We care a lot about women leading innovation and getting access to leadership roles. Do you have any thoughts about how we can create more access to leadership in healthcare and in innovation?
Yeah, I have a couple thoughts here. So I'm quite passionate about this topic. I've been very lucky to have very good mentors, both in the way they led teams, in what they personally taught me, and certainly want to pay that forward. So the first thing I think is important for teams in general, but especially women, just because statistically more of the lion's share of outside of work activities falls to women. And so creating an environment where getting work done is the most important thing and it's okay to take time for yourself, I think is really important. So this might sound silly, but when I go on vacation, people know how to reach me, but I purposely do not make it visible that I'm looking at or responding to emails because I really want to set the expectation that you do need time to yourself. Similarly, after hours, I love nothing more than spending time with my children and husband. So I hold sacred the hours between 5:30 and bedtime.
Yeah.
And I hope others do as well. So I think that's one that's quite tactical. Then there's the how do you develop folks and give them opportunities to grow? For our team, everyone has a development plan. Just the expectation is that we understand not just what team members are doing today, but what they want to do tomorrow, and make sure that we give them exposure to what they need to get there. Just because I think a lot of careers are horizontal and are really dependent on the experience you get that rounds you out. So we make a conscious effort around that. And then the last thing, I think it's again, not necessarily specific to women, but you more often see this in women. Very often, women think that they can't do something because they haven't done it before or haven't researched it enough, et cetera, and tend to have conversations around what's the worst thing that happens? What if you just said, I'm still researching this, but have the conversation anyway? Because so often, well, at
So
least
much
I
more.
learn by talking, not by reading, because you miss nuances otherwise.
Yeah.
And so I'm hoping that has worked well for the people that I've given that advice to, but go out of my way to try and give that.
Follow up with Caitlin if you have.
Yeah, exactly. I want real feedback on did that
Circle
resonate?
back. Yeah.
Yeah.
No, that's like really great. I'm actually curious too about like those mentors that influence you. I appreciate that you went there. How did you recognize who was going to be the right mentor for you? How did that unfold? Can you tell us that story?
I was talking about this with someone the other day where I think very often people think I need to find myself a mentor. And it's not that specific or that formal, or at least wasn't for me. I think I've been lucky to have been taken under the wing of several people where I've just gotten advice, whether because I asked for it or unsolicited, that was great advice about specific to me, what I needed, et cetera. So I think that's one category. Then there's another category where I really respected someone's leadership style. And so I'll email them and ask them a question. And then we'll regularly catch up on how would you think about X, Y, and Z? Thinking about what lessons you can learn from other people to take the nuggets that are consistent, but also find the style that works for you in particular, I think is really critical. And so to me, that means not just one mentor, but quite a few that you can ask a lot of questions of.
Yeah, and of course this topic comes up a lot on the show because we're interested in it. It's also just a good thing for people to be thinking about as they listen to the show, like who is in your mentor kind of advisory board, if you will, and just thinking about that there's something to be gained, but there's also something to give, and that it's a mutual relationship. It's not just a transactional relationship. It's really more than that. So.
Completely agreed. It's almost mutual respect where typically one person has more experience than another in a particular area. But I have a lot of peers that I view as mentors now where I love brainstorming with them. There's one in particular that I'm thinking of where we joke that we complete each other's thoughts because we tend to approach problems from opposite angles, but generally get to similar answers. And so talking with her, I normally round out exactly what I need to think, and hopefully she feels the same about me.
Yeah, that's great. I love that. Good to hear. You have how many partnerships are going on with Uber Health? There's 3,000 organizations that you're engaged with. Does that actually reflect a partnership strategy, or are these customers?
Combination of both. I do think a partnership strategy is incredibly important in healthcare in general, and especially at Uber Health. Again, coming back to what are our core competencies and what will we never do. I think a big mistake that is often made in healthcare is the need to own everything. Because then think about the poor patient and how fractured we are with point solutions. How many people would that patient need to talk to achieve their goal? So we've really been taking the approach of meeting the patient where they are. If they naturally come in through Uber because they need to get to an appointment, fine. Would love that and would love to pass on the relevant information to the other channels that they need, whether that's their provider, health plan, et cetera. If the opposite is true, where they have no idea who Uber is and they just need a ride or they're talking with their case manager, fine by us. Let's make it not confusing for the patient and meet them at their natural entry point. I think is really important in serving patients in a not confusing way.
Can we talk a little bit about food, the food
Yes.
side of the business? So how are you, I know you're getting food to patients. Is there any other element of food as medicine as a movement that any role you're playing with that?
Great questions. I'm quite excited about the food as medicine movement in general. We've been trying to be a bit more specific on what we mean just because that
Yeah.
term is so broad. It's always exciting when there's that broad a term because it means people are excited about it, but then
Yeah,
you need the specificity to really
totally.
get things done. So I view this in sort of three buckets. One is when you're solving for food insecurity, right? That
Yeah.
is a big piece of what's going on today. Second is when patients need help if they have a new diagnosis where they might want to avoid some foods or supplement others. And then third, where you need really specific micronutrients. I'd say we squarely sit in buckets 1 and 2 with how
Mhm.
our products work today. And just to give a sense of how they work today, we basically can work as a piece of a network with a health plan, through an 1115 waiver to allow both patients themselves, but really importantly, their social workers, case managers, providers, a call center to request things on behalf of the patient that comply with the specific rules the health plan has set. So what that means if you're solving for food insecurity, very often a good example is that pilot in Georgia we were mentioning. There were no restrictions, just what do you need? Here's $150 a month. There are other cases where plans will restrict to healthy foods, where it's pantry staples and fruits and vegetables. And I think that way we can meet the designs of the program, but in a way that technology allows it to scale by connecting to Uber's national grocery network versus having to choose a partner locality by locality.
You were talking about the research you were doing. Is this around the moms, getting
Yes.
moms to care? How do you track the outcome piece? Is that something that you all are playing a role in, or is it a partnership to execute the study to get those kinds of
Sure.
that outcome data?
It has to be a partnership. Again, coming back to the ecosystem and what pieces each individual actor sees, we'll see utilization and what folks are buying, right? So you can infer where there's need. We've been working with a wraparound telehealth nutrition support company that we're seeing what engages patients and what clinical interventions are needed, as well as the follow along adherence to that intervention. And then obviously, we're working with a large network of federally qualified health centers that are tracking the downstream clinical results and still tracking that today. And I think combining those data sets allows you to really think about what's the right program design, what's the right population, all the way from upstream engagement through downstream clinical impact.
Awesome. The idea of care at home obviously really surfaced big time. It's been there. Hospital at home has been around for a long time, but then of course the pandemic really put it into turbocharge, the idea of getting care at home and realizing that vision beyond getting patients to their appointments and the food to them and their medicines. Do you currently play a role in getting either clinicians to their patients at home or materials and goods and tools and things to patients at home? Do you play a role in that?
Yeah, on the margin, yes. I do think to your point, our core is transportation to and from appointments, delivery of groceries and OTC, and delivery of prescriptions to the home. We can deliver other things and have seen that a little bit. Where we do see a lot of uptake is movement of clinicians, actually. So if you think about this, especially in a city, you drive around, you look for parking, you pay for parking.
Yes.
You've been driving around the
Mhm.
block 4 times, the patient doesn't know where you are. There's actually a really nice ROI on replacing mileage reimbursement and parking reimbursement with an Uber, both from a cost basis as well as because you don't have to drive around so much, you can
Yeah.
anecdotally see an extra patient a day. And so we're
Wow.
seeing that pick up quite a bit.
Well, that's cool. That's great to
Yeah.
hear.
Yeah, it's really nice just seeing, to your point, our role in optimizing some of these benefits that have existed for years and years and trying to add that transparency and scalability and administration to drive a meaningful impact.
Wow. Yeah, it's really cool to see what you guys are researching and finding out about. Caitlin, I love also to hear where you came from. Like, how did you get into healthcare ultimately? I know that you've had your path from Bain, but what did you study and what was your early life like?
Oh, good question. So I I had a very boring early life, but in the best of ways.
Yes.
Two loving parents.
Yes.
Nothing bad happened to me.
Good boy.
Was taught to do the right thing. Very good, boring.
Yeah.
Very close with my family, which is really nice. And
Yeah.
then migrating to the professional world. Oh gosh, I thought I wanted to be a chemistry major. And then after one lab, realized, oh my gosh, I'm way too extroverted to be a chemistry major.
Stop talking. You're talking again.
Exactly. So switched to economics, and Kaylee had no idea what I wanted to do. So
Yeah.
so that was my path to healthcare was a winding one, and now that I'm in it, never want to leave it. But truly just kept doing things and taking jobs where I could learn as much as possible. So leaving school, joined a hedge fund because you learn a lot about a lot of industries. The things I still randomly remember about satellite providers or cable providers. It's a good party trick.
Yeah.
And from there, when I ended up at Summit as a operational consultant, we were technically generalists, but I really ended up spending a lot of time in their healthcare tech and services companies. To me, the combination of once I'd done something where I knew I was helping a patient at the end of the day, I couldn't look back. And that combined with, because the environment is so complicated and highly regulated, the problems are really interesting and you can differentiate yourself from your neighbor. So helping people complex problems to me is the dream job.
Oh my gosh, yeah. And I love it's one thing to talk about ideas, it's one thing to do this analysis, it's one thing to do research and have an understanding of something, but then to bring it to life is yet a whole nother. The operations is just another next level, and making sure that all the vision actually comes to life the way you envisioned it, which is not so easy.
For sure. And doing that in a way where you can move quickly enough, I think, is one thing we spend a lot of time, and I spend a lot of time thinking about. I think it doesn't work if you're the bottleneck, right? So how do you build a really effective team where you're delegating decisions, not just tasks, is really the only way that you can move at a pace that allows you to scale. And making sure that, to your point on the insights and the analysis and the idea versus the execution are quite different, making sure that you turn your thought into a practical playbook that is impossible to miss, I think is really key. And the other thing that we actually think a lot about is how do you do that for the products, the services, the solutions that you've already built while leaving room in your org. It doesn't need to be across every person for that what's next. To the point we were talking about earlier on, how do you have the visionary conversations with the industry, with your customers, so that you aren't an order taker, but a co-creator.
Yeah. Oh, nice. Is there an innovator out there that really inspires you? A company doing something really cool, that whether it be in healthcare or externally? Is there anything that's currently really?
There's a lot. I think maybe I'll talk about the themes that I think are super interesting. I think it's really interesting to solve for infrastructure problems. What is not the obvious problem and how to create a better mousetrap there, but to think about the root cause of that problem and how you solve for that. There's a couple companies there that I have my eye on and I think are quite interesting. I'm probably less of a specific answer than you.
That's okay. I understand. Yeah. Have you had to pivot your strategy in any way? Have you hit a wall and had to rethink?
I think that happened. One of the things that we've done to avoid that 180 or even 90-degree pivot and have more micro pivot is by doing what we were talking about. Think multiple years ahead with our customers, your buyer. You've pitched them what they need, they've agreed, and then you're co-creating what that solution looks like together. That long-term thinking really helps you avoid some pivots in the short term. One of the things we talk a lot about is when there's a pivot, is there solution risk, product risk, or is it timing risk? And we've been quite lucky because of that long-term view and tight relationship we have with our customers that during my tenure, at least, if there's been risk, it's been timing risk versus execution risk, which is We'll probably end at some point, but we've had a good run.
Yeah, no, gosh, if you're just leveraging learnings, keeping an eye on the risks,
Exactly.
evolving,
And trying
the
to avoid
microwave, which is a good approach. It sounds like it's very solid.
Yeah, it's been thoughtful. I think the further ahead you can get yourself in conversations with your buyers, the less risky even long-term bets are.
Do you see any fast followers trying to catch up to what you're doing?
What's really interesting about what we're doing is we're a platform and there's value in that platform. And I think it's really hard to become a platform in healthcare, both because of the technology requirements to execute it, and two, because of the time horizon to returns. You need to believe you're already an existing player for it to work, just because of sort of again, how long it takes for platforms to be adopted. On the individual benefit side, we do see others playing in those spaces. And I think especially the food space is the most nascent. And so there's the most players in that space. We tend to view those companies as potential partners versus competitors, just because our real value is not the underlying service, it's the data connections.
Yeah.
And so I'm not sure that I've seen anyone who's built an analogous product to what we have. And those that have on the edges are more complementary than competitive.
Yeah, that's a good attitude. Anyway, competition.
Exactly.
That's great.
Yeah. This was such a lovely conversation. I think you tackled the sort of my approach in general and Uber Health's approach is how do you find that root cause problem and solve for that using your core competencies versus just try to create a better mousetrap. And I think that's what we've done with taking these existing reimbursement sources and building that product that helps optimize them in a way that's sort of certainly win for us, but win for plan, win for provider, win for patient.
Yeah, the triple crown.
Yeah,
triple crown. No, that's great. Congrats and good luck. We're going to keep an eye on you guys and excited for your continued success.
Thank you so much. This was such a lovely conversation. Truly made my day.
Thanks for joining us for the Game-Changing Women of Healthcare, a production of the Krinsky Company. Today's episode was produced by Calvin Marty, Chelsea Ho, Medina Shabich, Wendy Nielsen, and me, Meg Escobosa. This podcast is engineered, edited, mixed, and scored by Calvin Marty. If you enjoy the show, please consider leaving a rating and review wherever you get your podcasts. It really does make a difference. And share the show with your friends and colleagues. If you have any questions, comments, or guest suggestions, please email us at podcast@thekrinskyco.com and visit us on the web at thekrinskyco.com. Interested in supporting this show and reaching our engaged audience? We're looking for sponsors for this season. Help us put the spotlight on women leaders in healthcare. Email us at podcast@thekrinskyco.com. And thank you.